I have a lot of patients come in for breast lift, but they don't really know what they want. Do they want a breast augmentation to increase the upper pole volume, or do they want to lift to restore the nipple position? And so this is usually a talk I have with my mommy makeover patients, people who are coming in after pregnancy when their body's changed. They really want to restore it back to what it looked like before pregnancy. So one of the main components of that is breast surgery. So if you come in and your nipples are low, we need to raise those up. That's the breast lift. And if you have droopy tissue, we get that fixed and get your breast nice and perky. Now, if you want a little bit of upper pole fullness and projection, that involves an implant, which can be done at the same time. It's actually one of our most common procedures. And what I really like to do in those procedures is add an internal bra, which prevents the recurrence of that breast ptosis or the droop coming back. Really nice procedure for people who have had pregnancy or are unhappy with the appearance of their breasts. The good news is, breast lift is mostly a soft tissue surgery, so it's not a lot of pain in general. You do have some swelling for a couple of weeks, but most of my patients are able to get back to their jobs as long as they're not doing heavy lifting after about a week or so. Some people even can go back as soon as taking a weekend off, taking 3 or 4 days off and getting back to a light activity type job. The recovery is mostly, you do feel a little bit tired like any other surgery, but that usually gets better over the first week or two. The typical breast lift patient or implant patient, and it's not just people who have had kids. Some people unfortunately have congenital ptosis or naturally droopy breasts, and they want to address that. So, we do breast lifts on patients from about 18 years old to into their 60s and 70s. So it's a very wide range of a patient population, and a lot of people need this surgery. And it does a fantastic job. It has a super high satisfaction rate after you've had this procedure done with the way you see yourself and your self-confidence. So it's one of my favorite things to do.